Clinical Microbiology. By Dr. Zabiur Rahman Mamnoon. SARS. Coronavirus is SARS. The deadly SARS virus, SARS-like coronaviruses or SARS Cov, by Dr. Zabiur Rahman Mamnoon. In November 2002, there was an outbreak of severe atypical pneumonias in China. The cause of this outbreak was not known and was initially confined to the mainland. In early 2003, the disease has spread to Hong Kong, Singapore, and Toronto, Canada, and the syndrome was called SARS, Severe Acute Respiratory Syndrome. Within a few weeks of the description of this syndrome, it was discovered that SARS is caused by a virus, especially a novel coronavirus, SARS Cov. Coronaviruses are a family of single-stranded RNA viruses, previously only known to cause the common cold in humans. Before the outbreak was controlled, it had spread to 29 countries and territories and infected over 8,000 people. SARS is an example of an emerging infectious disease. This virus was not known to exist previously, and since the initial outbreak has not caused any additional natural outbreaks. An identical virus has not been found to exist in any natural reservoir, though similar viruses have been found in bats. SARS-like coronaviruses have been isolated from Himalayan palm civets and raccoon dogs in markets in China. How people first infected with this virus remains unclear, but one theory is that it species barrier and caused the epidemic. Clinical features of SARS. The primary mode of transmission is thought to occur via direct or indirect contact of mucous membrane, eyes, nose, or mouth, with infectious respiratory droplets. While this virus is not as transmissible as was previously thought, it appears that there were a few persons who were responsible for more transmissions. This is called super spreading events. A lot of transmission of this virus from one person to the next occurred in hospitals and other healthcare settings. After a 2 until 10-day incubation period, people infected with SARS often presented with fevers, myalgia, and chills, and later developed a dry cough, chest pain, and shortness of breath. Surprisingly, few patients develop sore throat or rhinorrhea, as one might expect from a coronavirus. Most patients present to the doctor with an abnormal chest radiograph or chest CT scan showing alveolar consolidation, which can progress to frank ARDS, the acute respiratory disease syndrome. About 20 to 30% of patients required admission to an intensive care unit, and most of them required mechanical ventilation. About 8% of people with SARS died, and this was primarily due to respiratory failure. Diagnosis. During the outbreak, a case definition was developed by the World Health Organization (WHO), which had a high sensitivity but a very low specificity. This is because the clinical features are not unique to this virus or disease. More accurate diagnosis can be made by reverse transcriptase, quantitative polymerase chain reaction (PCR), testing for the viral RNA in respiratory secretions, feces, urine, and from lung biopsy tissue, or seroconversion, detection of antibodies and the to the virus. Treatment. The optional therapy of SARS is not known. Patients with suspected SARS are generally treated empirically with broad-spectrum antibacterial drugs that are effective against other agents that cause community-acquired pneumonia. Ribavirin was often used in the treatment of SARS, but it was later shown in animal models that this drug had no effect against this virus. Corticosteroids were also used frequently, though there is no solid clinical or animal data to support their use. Generally, treatment is supportive with mechanical ventilation and intensive care. Take care of yourself. Health is wealth. Thanks for attention.